Referring to the top half of Miller's pyramid, with levels shows how and does, are again a number of assessment approaches. One of the most commonly used approaches is the Objective Structured Clinical Exam, otherwise known as the OSCE. In this case, standardized patients or patient actors present real-life case scenarios in a clinical context to assess a variety of clinical competencies. Having the student exposed to or assessed by formatively or summatively to a number in a number of OSCE situations helps improve problem solving ability and also improves or increases the sampling of competency performance or skills performance and has an effect on reliability. The OSCE itself is a series of performance tests, everything from history taking, general communication, physical examination, specialized tests. The station includes standardized patient encounters, which are the patient actors, occasionally accompanied by written challenges, and includes an interpretation of imaging and lab results. For an OSCE to be done properly, it should be blueprinted, and blueprint meaning matching the course or related to the course or the curriculum learning outcomes at hand, or the ones that the student is responsible for. It requires training of the standardized patients and the examiners. They tend to be costly, and they do provide a fair and reliable method of assessing clinical skills. Another form of performance assessment or workplace-based assessment, in this case the teaching clinic, is referred to as case-based discussion, also referred to as chart-stimulated recall. It uses the patient health record to assess clinical judgment and clinical reasoning. The rater assesses the learner's rationale for diagnostic and treatment decisions. An example of a case-based discussion chart would look like this. We'd be looking at record keeping, clinical assessment, treatment, investigations, follow-up, clinical reasoning, overall clinical care. Under this rubric of borderline or below expectations, borderline, meets expectations, or above expectations. Importantly, at the bottom of this chart is a place to insert key learning points and issues of discussion with the faculty and agreed upon actions. So therefore, the student leaves the discussion, or the learner leaves the discussion with a plan. Again, yet another form of formative assessment in the clinical environment is SNAPS, which is an abbreviation for Summarize, Narrow, Analyze, Probe, Plan of Management, and Select a Case related issue. It's a learner-centered model for clinical education. If you follow the SNAPS protocol, it gives an instructor or clinician or attending and student a structure with which to formulate that formative encounter. And summarizing again is a brief history of and exam findings. The student then narrows the differential diagnosis to 2 or 3 relevant possibilities. You analyze the differential list by comparing and contrasting the diagnostic possibilities. You probe the learner by asking questions about uncertainties and difficulties or alternative approaches. It calls for a plan of management for the patient's health-related issues, and then select a case-related issues for self-directed learning. Again, SNAPS is a collaborative learning conversation between the learner and the teacher. It has been referred to as a cognitive dance, where one partner leads, but each must know each other's steps. Useful considerations are that SNAPS model orientation is required for the instructor particularly, pocket cards with prompts for learners and teachers are also helpful. And this ends this brief presentation on skills-based or performance-based assessment related to the Miller's Pyramid.